into the brain that I can't see. Please understand, I see nothing. The technology guides me and the patient's feedback guides me to do what I'm doing. The two guitarists, this is the lesion in the brain. MRI scan showing me pre and post. As you can see that. The two guitarists doing a jugalbandi. They became good friends. This guy was an avid mountaineer. And 3 months after he did this brain surgery, he climbed a 7,000 meter Himalayan mountain. He called me and said, Doc, I want to go for trekking. I said, are you crazy? You just had a brain surgery. He said, I feel fine. He said, up to you. And he climbed that. That means to say, nothing was happening function-wise, in spite of me burning the motor thalamus. That's how good these are if you do it well. This is him 9 months after surgery. Look at his fingers. Look at the dexterity of those fingers. Going next, writer's cramp. That guy had guitar cramp, this guy had writer's cramp, 26-year-old guy, he starts writing, he gets into a cramp, you can't see him, look at the way how clumsily he's holding his fingers. His handwriting before writer's cramp, 1 month before surgery, the day of the surgery, he could only write half a page. And see how dirty his handwriting is. Look at his handwriting after surgery. These are all functional outcomes. The proof of the pudding is in the eating. This is him writing. We go next. So we finished ventralis oralis nucleus. Let's go to another nucleus in the thalamus called the VIM, which is the ventralis intermedius nucleus of the thalamus. So this child had a head injury when he was 9 years old, crossing the road to go to school. He had a bad head injury, unconscious, recovered. After he recovered 3 months, he developed this movement disorder, and he had this for 17 years.
Please
17 years he had this problem.
That's nice. We hope in the next 2 hours this will stop, Travis.
This is him second day after surgery. VIM. That is able to take hand to mouth. He has some cerebellar signs, which is also part of his injury, which I can't do anything, but at least he's that much better. Able to pick up things, started learning to wear his shoes, tie his lace. This is him 1 month. He's able to at least take the bottle to the mouth. He still has some tremor in some odd positions. He's much better riding a two-wheeler or driving his car and all of that. Next, Parkinson's disease. I'm quite sure all of you have heard Parkinson's disease. So let's look at this. Look at this lady with tremors of Parkinson's disease. Many of you might have had some relative in your family having this tremor. Very severe tremor. Does not respond to syndopa. This lady would not remove her bangles. It would make sound all the time, argument in the house, and so on and so forth. So now I'll show you during surgery. Just watch her hand tremor as I'm lesioning. Hand is tremoring. That sound is lesioning. Keep watching. Boom, stop. It's as dramatic as that. The tremor stops 100%. This is her post-op, no tremor. So this is the somatotopy of how the whole thing, like you have the motor cortex and everything, somatotopized everywhere in the brain, it's like that. This guy is pre-op, on phase, off phase, post-op, walking well without motor fluctuations. One more PD. I'll show you this guy. So this guy had tremors, 7 years, hand and leg, only one side. He couldn't walk backwards. You can see him getting better. He wanted to read the newspaper without his hand shaking because he was a retired guy. So this is him. 1 year after surgery, no tremors, is very comfortable, travels by KSRTC bus, so on and so forth. Look at this. Cervical dystonia. He's a businessman from Mangalore. Imagine somebody sitting in front of you and keeps on doing this. You will get psyched up yourself. Can you imagine how fatiguing it is for him? You know, he's having like this for 7 years. No treatment worked. This is him after surgery. Then, this is the two lesions in the brain. This is in a new area called the GPI. the globus pallidus interna. All of you have heard of it? GPR, globus pallidus interna. The corner of globus pallidus is called the PVP, which is the posterior ventral pallidum. That corner I have to lesion. Only then you get this result. Another cervical dystonia. This was my first surgery I did in India. This is him after surgery. He's 60% better. He's still very happy because neck pain has gone away. He could see his cricket match without having to shake his neck. This girl came from Varanasi, BA English. She's fine as long as she's sitting. The moment she stands, she starts some strange power starts pulling her down like that. Her head is down, she walks like that. Can you imagine? This is a heavy dystonia. So it's not, the results of this is not as dramatic as with thalamotomy. It takes 3 months sometimes. She slowly got better. And this is her after 2 years. She developed a little bit of dystonia on her foot. Otherwise, she's much better. The bend is gone completely. The head tilt and the bend is gone. Only the right foot has a new dystonia she's developed. Can you burn both sides of the brain? This was a question very few people know to answer. I'm probably one of the few surgeons burning both sides of the brain in India today. Is it safe? Is it possible? Can it be done? How are the results? Let me show you this patient. Parkinson's disease. You see him walking. Left more than right, tremor, classical Parkinson's disease, festinant gait, no arm swing, bradykinesia, rigidity, mask-like face, classical features of Parkinson's disease. This is 18 months after the one-side surgery, left side tremor is gone, his gait is much better, arm swing is better, right hand tremor, left hand no tremor, right hand tremor, left hand no tremor. Between the first and second waves of pandemic, he came and told me I need the surgery on the opposite side. Patient pushed the surgeon to operate, not the other way around, because he got great results on the first side. This is him, 1 month after surgery, second surgery. No tremors both sides. He was a tailor, he's gone back to tailoring. Imagine even the foot control is fine, not just the hand control and cutting. This is him walking. He works in Victoria Hospital. Even in anxiety situations, he does not have any tremors. He's there, he's able to manage. This is the article that got published in the Romanian Neurosurgical Journal. This is a deep brain stimulation pacemaker in the brain. We do that also. Another Parkinson's disease patient, classical bradykinesia, rigidity. That was burning circuit. This is placing a pacemaker in the brain. This is called levodopa-induced dyskinesia. This is a side effect of the drug. Once this happens, you can't increase the tablets anymore. This is an indication for surgery. This is when he came to us for surgery. This is him after surgery. This is the target called STN, which is subthalamic nucleus. So there's another basal ganglion nucleus called the STN. That's the target we do for this surgery. You can see how many places in the brain that we are fiddling around with to do different results at the end of the day. I'll skip this for one of time. I want to show you this. This is another dramatic result. Oh, not this, sorry. Oh, sorry folks. Yeah. This boy had his neck like this. Look at the video on the right hand side. His father is holding his head. Just watch, he's going to leave the head now. Just watch what happens. Can you imagine? He had this from his age of 17 years. Severe retrocollis. Mother has to be with him all the time to hold his head, even to go to the bathroom. How much is that for a quality of life, not for the family, not just for the patient, but for the family? It's that terrible. Look at him trying to drink water. Father has to hold his head, but look at the bottle. I mean, we are talking about fundamental human rights. We're not talking about him going and earning money. It's just about him managing himself. Forget about anything else. Now if you see here, he's not able to leave the bottle. The hand has got stuck to the bottle. The father has to hold his hand, hold the bottle for him to release it. Now he should use his right hand to lift up his left hand. He can't even use both hands independently. So I had to give general anesthesia to put the frame. Then I had to wake him up under anesthesia to get the feedback. Did all the dramatic stuff. Then as he went through rehab, post-surgery, 2 sides of the brain burnt. Neck is much better. 4 months. Look at this. Neck is straight. Nobody's holding his neck. Though he has a little bit of a wobble, he's still much, much more stable. And then look at him trying to drink water. Same bottle, he could do nothing. In spite of holding the head, he's able to take it to the hand, to the mouth. Okay? So this is him. He still has some cerebellar degenerative processes, but he's able to manage himself. He goes to the field. He supervises the, servants, the people there working, so they're quite happy. So let's go next. As you see, I'm a brain circuit surgeon. Not just a brain surgeon. I'm fixing misbehaving brain circuits. Let's go next to another problem called spasticity. How many of you have heard the word spasticity? Cerebral palsy, spasticity, tightness. You've seen stroke patients walk like this. You've seen patients walk like this, spasticity. Spasticity is the bugbear of all neurologists, neurosurgeons. In a simple medical layman's terms, we say it's like trying to drive the car with the handbrake on. You don't have smooth movements at the end of the day. So, it also helps in disorders of consciousness. To manage spasticity when it's severe, we do something called intrathecal baclofen pump. So we implant a pump in the anterior abdominal wall. There's a catheter going into the spinal cord directly. The drug gets delivered in the spinal cord because oral baclofen does not cross the blood-brain barrier. So we have to bypass that barrier and cheat the system and get inside. The pump costs 8.5 lakhs. So let me show you some results of patients who woke up. This boy had a severe head injury, deeply unconscious, stuck like this. Many of you would see patients like this, completely stuck because of severe generalized spasticity. He was deeply unconscious. We didn't know whether spasticity or severe myofascial tightness. So the rehabilitation team comes into the OT and does examination under anesthesia to distinguish between TCD and spasticity. So they come in, they measure under anesthesia, all the PROM, the range of movements, all are calculated and written down. Once they figure it out, I leave a catheter in the spinal canal, do a trial. This is the rehabilitation team with me. We have a table that we check the modified Ashworth score every 2 hours, and based on that, we keep titrating the dose of the medicine. Once we know it's happening, we put the pump. This boy woke up in 1 month. From deeply unconscious, this boy woke up. He started playing chess now. 10 months into the process, he still has a lot of deformity on the right side because of improper rehab in the beginning. He's cutting his birthday cake. Parents are very happy. Look at him, the guy whose hand was like this, is able to now change channel on the remote to the channel that he wants. He's able to leave the remote carefully without dropping it down and pick up a chip with his left hand and put it to his mouth. No ataxia, nothing. Next, look at him. He still has some speech problems, but look at his language on WhatsApp. Perfect English, perfect grammar, including capital letter, small letter, emoji, everything. For a boy who was unconscious for 5 months, this is his level of cognitive recovery. Can you imagine how happy the family can be if he can produce results like this? He was written off in the other hospital that he's going to remain like this, just take care of him. Today, from that place, the family is ecstatic to seeing him like this. Some more of his chats on WhatsApp. When are you coming? I'm getting bored of playing. So many things. He's such a lovable kid. This guy is from Yemen. He had a bomb blast injury here, which had impacted both his brain and spinal cord, and he had severe spasticity. Look at this guy. You lift up his hand, and he goes into spontaneous clonus like this. 7 years, he's not moved his limbs, both lower limbs. He shakes like that. He gets distressed because it's so painful. And when he gets angry, he starts doing this to stop the shaking from happening. The hand is also like this. So I did the intrathecal baclofen pump. I've just implanted the pump, switched it on, reversed the anesthesia, and brought him to the recovery room. How long was that? Just look at him. He's already showing me that his left toe has started moving. His left toe has started moving. Just watch him now. I'm touching his leg, no clonus. He's showing me. My foot has started moving after 7 years. And just see what he does now. You see that? This is a nasha for us. No money can buy you this. This is why we surgeons operate on complicated cases to get results like this and patients' responses like this. And he got better. Guy who could not move his leg, he started to stand. He went through rehab. He said, for 7 years I have not moved. He's giving the Arabic translation. Next one, well done to the workers of this hospital. First time everybody had given him up. After 15 days, see what he's doing. See, no, here. Just watch him now. Somebody, just look at his stepping. No spasticity at all. Oh, it's in that way. Here, huh? No, it's not there. It's the next video. Oh, there's a video of him dancing, standing, which I think is not here. Anyway, so this guy, he had a transverse myelitis, same spasticity on during recovery. He's a taxi driver. He's able to drive taxi now. Intrathecal back left hand pump. He's able to sit down on the ground. How many of you, I'm quite sure some rehab people, as they look at him on the last side video, he's able to sit down on the ground. He could not walk 2 steps. That's the power of neuromodulation with neurorehabilitation. It's not just one of them. You have to do it together. He's able to get up from the floor without support. During pandemic, his pump went khali and he developed spontaneous clonus. He kept asking me, doctor, do I still need the pump? So look at it, that's spontaneous clonus. That's not tremor. That means he still has that. Look at this video, down. 90% of the clonus is gone. The time difference between the above and below video is 3 minutes. That's it. Filled up, not filled up. So the human brain is still an old-fashioned wired model. Please remember this. Don't think technology works everywhere. Even if Sundar Pichai of Google, his son is weak in mathematics, he needs mathematics tuition. He can't put a USB port to his head and expect to import mathematics to his brain. People think things are very easy. Hello, Prabhakar sir, you just put the USB port of Harrison or Davidson, so everything goes. It's not going to happen. If Sachin Tendulkar's cover drive is weak, sorry about that, guys. Just put that in there. He can't put an exoskeleton to his hand and expect the cover drive to improve. He has to practice cover drive. Is that okay? How did that happen? Yeah, I stepped on it. I know I stepped on it, but will come. Yeah. So why our brain is not Wi-Fi enabled? So let me show you some rehab stories. I'm going to go to brain function tests. Is it possible? Is it practical? Can we mass customize it? And we have done it. We are the first people to come up with comprehensive brain function tests. It's available online. It's called the SAFA test, self-evaluation of functional abilities. If you go to the website rebootingthebrain.com, which we own, you can see this test. You keep a patient in your mind, you answer this, you will get a result. We have a rehabilitation index and we've got brain rebooting protocols based on this science called the Care Power framework, which is clinical, anatomical, radiological, etiological, and rehab. This is the patents we hold. This is the first patent. This is the global patent, 184 countries. This is the American patent that we have applied last year. This is the second patent. So all this is happening, being accepted means something like this doesn't exist. This is the competition which Dr. Prem Kumar said that I won last year. 3,000 plus bio-entrepreneurs from across India participated in this. So I want to show you some stroke results before I wind up. Look at this boy. Head injury. 2 months after head injury, he was a student. No eye-to-eye contact, no speaking, right hemiparesis. You see him walking on indoor streets.
Hello doctors, thank you so much for healing me.
5 months.
I couldn't express my feelings I have for you guys. Thank you.
He's riding his scooter in indoor, again without helmet. So I said, we run a program in Jain Hospital, a life membership program, 2 times admission, 1 time free. For those who want to continue to admit and spend their money and time with us. Do you think he's normal? Not yet. He still has some subtle cognitive issues that we can pick up with our system. It looks so, I can't look at your face and tell your blood sugar. I can't look at your face and tell your blood sugar, blood pressure. You have to check. Similarly, we have ways to check this. So, this girl, severe head injury, came from Mumbai to Bangalore for a holiday. We have done a decompression craniotomy. You see left side, right side, there's no skull. Can you see that? She's deformed. The skull is sitting in an abdominal wall, deeply unconscious, tracheostomized. Took 2.5, 3 months to wake up. Comprehensive rehabilitation, not just one domain. Slowly woke up. All 4 limbs were weak in the beginning. Then left side started improving better than right side. She woke up. She started doing some gestural communication. She started getting a little better. over 5 to 6 months of rehabilitation, teaching her how to eat, teaching her how to put toothpaste on toothbrush. This is all occupational therapy work. So every of these things, every task, every skill has to be retrained. And then she went home. This is how she is today. She still has some problem, but she's able to manage herself. She's back to college. She has a foot drop because of lower end of femur problem. She's eating right hand, left hand, appropriately, chewing, able to adjust. You see, socially appropriate behavior, not just eating. She's able to turn bed mobility, turn to the right. We told her to demonstrate that she can turn and get up both sides, so she's demonstrating that she can do either way. Each of this has to be checked, trained, retrained, and verified. Dressing. She used to do TikTok videos, so she's back to that.
तुम समझती क्यों नहीं अगर मैं यहाँ रुका तो वहाँ भंडारा खत्म हो जाएगा.
So from coma to TikTok, she's back to her life. Imagine, guys, what is possible. This is her back after 2 years, 15 months after the TBI. This is her before the injury with the same dress. This is the reality of neuroscience. But this is also the joy of doing things well. So this guy, he had a cerebellar hematoma. We operated, deeply unconscious, nearly arrested because of atrial fibrillation. He is recovered. But I want you to tell this story. This guy, he walks into a corporate hospital 7 years ago. He was my old patient with severe vertigo. Walks into the emergency and asks for me. The emergency doctor there said, it is not Dr. Sharan's problem, it's an ENT problem. They called the ENT doctor. ENT doctor said vertigo and admitted him. Next day morning, he was found to be semi-conscious, drowsy. The neurologist was called. She said, maybe stroke, get MRI done. That hospital did not have MRI. They went somewhere for MRI. All the drama happened. By the time he came back from MRI, 5:30 in the evening, he had a large cerebellar infarct. Imagine. Now he was deeply unconscious. And then when I entered the ICU, he was already on ventilator. I told the family, we have to operate him and decompress. And his brother-in-law is an anesthesiologist who was the head of ICU of another private hospital in Bangalore for 15 years. When I told him that, he said, Dr. Sharan, with due respect to you, I have never seen even one such patient survive in the last 15 years. This is what he said. I said, Mahesh, not only have I seen patients surviving, I have got enough patients back at work. He did like this. He said, do what you want. I operated him. I told the wife, I think I timed my surgery correctly. For next 3 weeks, he was deeply unconscious on ventilator, not even moving an inch. The intensivist, everybody gave up. They said, shall we prognosticate, palliative care, shall we withdraw support? I said, nothing doing. There's something called cerebellar asthenia. Just ventilate him for 3 weeks, he will wake up. Nobody believed, but they had no choice because I was saying what I was saying. 2.5 months to wake up, tracheostomy peg, he went through everything. This is him, climbing Chamundi better now. No deficits. Can you imagine if we had written this fellow off? When I parked my vehicle one day during the pandemic, when kinetic Honda came, Namaskara doctor, see me this fellow riding a kinetic Honda. To that level you can improve, guys. That is the power of doing things well. Next, from coma to cooking. This lady had intraventricular hemorrhage. She had bilateral blood, the hematoma was resolved. She was brought to our hospital for rehab. You can see both burr there. When she brought her husband, another 5 minutes I'm done, sir. Her brother came and asked me an honest question. He was a trustee of our hospital. He said, Dr. Sharan, is it worth bringing her to this hospital? I said, why are you asking me that question, sir? He said, Dr. Sharan, I have to fund the bill. She has no money. Is it worth or shall I take him home? Take her home. I said, it's worth it, sir. Here is she, after 6 months, making chapatis at home. She still walks with a walker, but she's cognitively well, and she's able to do that. This is the power of comprehensive rehabilitation.